Welcome to Between the Sheets, the podcast where we're going to cover a variety of topics related to sexual health and wellness. I'm Dr. Stephanie Zwonitzer, your host. I'm a nurse practitioner and have been in practice since 2017. I have my Doctor of Nursing Practice degree, and I specialize in urology and sexual health. I am so excited to explore all of the various topics related to sexual health and wellness with you in a fun, spicy, educational, and non-judgmental manner. So come on, let's get between the sheets. Hey there, happy hump day. Welcome to the pilot episode. I'm pretty excited for this. Of course, the first thing I'm going to talk about is communicating your sexual preferences and, of course, consent. I think that's a great place to start a sex podcast. Communicating about sex. If you can't talk to someone about sex, you shouldn't be having sex with them. I once had someone tell me that, and I think it's pretty great advice. Consent. Consent is ongoing. It's not just once. It's not just, hey, do you mind if we do this? Or do you want to have sex? Yes, great. That's a great place to start. You don't want to start at all without consent. But consent should be ongoing every time you get to say yes or no. And even during a session, you might say yes to something and no to something else, and that needs to be okay. So make sure first and foremost that you always have consent from your partner. For communicating with your partner about sex, you really want to plan for this conversation. You really want this open dialogue between the two of you, and you want it to be a safe and comfortable conversation for you. So for planning this conversation, pick a neutral place that provides some privacy, because you're talking about spicy things, for the delicacy of this conversation. But be patient, be respectful, be sensitive. Try using I statements and approach with a positive mindset. I like it when. It feels good to me when. Those are the things that really help spark growth in a relationship and communication and pushing sexual experiences forward. Ask questions and get clarification. If you're not sure what something meant, ask. It's okay. Pay attention to nonverbal cues and clarify when needed, not only during this discussion, but anytime you're having sex too. Decide on what is allowed to be said during sex. There are certain words that really are triggers for some people that some people are okay with and some people aren't. One of those words is cunt. Some people are really okay with it. Some absolutely hate that word. Maybe you need to decide whether or not that's a word that's allowed to be said during sex. Are you allowed to call names? Are you not? Do you have a pet name that you can use? Is there anything that you should or should not say during sex? That's a great part of this conversation. And have a debrief after sex. Talk about if something was good, bad, if something happened that you said a word or a phrase that didn't quite click. This can be an ongoing conversation. This does not have to be a one-time coffee date at Starbucks where we talk about sex and never talk about it again. This should be flowing and constant and ongoing. Safe words. There are some sexual experiences that need safe words, so make sure that you have them, that you're agreed upon them, and that you change them if need be, but that they are clarified, especially before sessions where they might be used. And allow the word no to be okay. Just because someone doesn't want to do something in particular, respect their boundary. If that's something that you really need, then this might not be a person for you to have sex with. And that's okay. We all have preferences. We all have different things. Some people like ass to mouth. Some people want nothing to do with it. And both of those opinions need to be respected. And that boundary needs to be set. When you're talking with your partner, you want to talk about safe sex practices, right? So you want to talk about, have you gotten your STI testing? When's the last time you had your STI testing? And are you going to use condoms? Are you going to use contraception? How are you going to prevent pregnancy, or do you want to prevent pregnancy? As far as the sexually transmitted diseases, we will have an episode coming up that will specifically get into the various common STIs and the discussions that you can have with them. Today is just being that this should be part of your conversation, being open with your partner and making sure that you guys are on the same page with who has what or does not have. Likes and dislikes. So talk about your likes, talk about your positions that you like. What do you want? What gets you your best orgasms? What do you just absolutely hate? Or is there some type of body image issue in a certain position versus another? And maybe your partner can say, hey, I don't see that at all. It's not really that big of a deal. And you can kind of calm down about that. There are certain positions that maybe give you better orgasms. That should be discussed in this conversation. Areas that you like to be touched, areas that please do not touch me there. I get way too ticklish. Do not touch my feet. Or maybe you like touching feet. That's all good. Just make sure that that's really well conveyed. Talk about your style of kissing. Do you like a lot of tongue, a little tongue? Do you want kisses all over the place? Do you want a lot of kissing before you have sex? Do you not want a lot of kissing? Are you not a kisser? Those are all specific things that can enhance a sexual experience. So really taking the time to divulge that information between the two of you. How long do you like a session to last? Are you a quickie? Do you like a long one? Do you like a variety? I sure like a variety. But some people really only want sex to last for a few minutes. Some people are disappointed if it doesn't last at least 20 minutes. So having those expectations and those conversations can be really helpful up front. And again, going along with your relationship, if you guys have had 5 to 7 minute sessions of sex for 2 years and you're, hey, I really want a longer session, have that conversation. Don't be afraid to bring these topics back up. Talk about which your sensations you like best and what gives you those. Do you like a soft touch, a hard touch, a slap here and there, or a firm pinch on the nipple, something like that? Whatever your favorite touch is, talk to your partner about that. Do you like dirty talk? How do you want to talk in the bedroom? That's a big thing to talk about. Dislikes are just as important as likes. We've kind of touched a little bit on going back and forth of that with the kissing and the touching. But make sure that you talk to your partner if anything is off limits. If you're not into anal, you don't want to play with toys. There are certain positions that are painful for you. There is something that happened in the past that a certain sexual activity is triggering for you. Make sure you talk to your partner about that. Anything that could relate to a bad experience, certainly you don't want to bring that forward into new experiences. Another topic to talk about is kinks. So did you know that anything besides just missionary is considered a kink? Because I learned that. I thought just regular vanilla sex was about all of the positions, but apparently no. Nope. Anything outside of just missionary is a kink. So that leaves a lot to be discussed between you and your partner. That can be very minimal to just liking different partners, or excuse me, positions. But it can also be liking multiple partners or different partners, liking different roughness, hardness, different toys, different apparatuses that you might have sex on. It might be that you like having sex in all the different rooms of the house except the bedroom. Or maybe you don't want to have sex anywhere besides the bedroom. All of those things should be conveyed during this conversation. And the last thing with kinks that you might want to talk to your partner about is if you guys do want to explore some things and you want to see where you're at and where you jive at with your different kinks, you can take online tests. There's all kinds of tests out there that you can take, and it helps you figure out what you like, what you don't like, and then it gives you and your partner an area to compare and discuss things that might be different or the same. Another thing that you might want to talk about with your partner is fantasies. Fantasies are a great thing to talk about. They can be very fun to text each other and to get some different ideas that then when you're together can make a really fun and spicy time. And it's just kind of fun to explore new options and topics with your partner. And fantasies should definitely be an ongoing conversation, because what you might like in your 20s or 30s might be completely different than a fantasy in your 30s, 40s, or 50s. Another part of the topic and conversation with your partner should be frequency. How often do you want to have sex, or what's your expectation? Is it daily, weekly, monthly? Are there any occasions that will have a little extra spice to them, like birthday sex or anniversary sex? They get a little extra something. Will there be longer sessions? Will there be quickies? Is there a way to have sex when the kids are in the house versus when they stay at grandma and grandpa's, or anything like that that you want to talk about in relationship to your sessions? Should definitely be open communication between you and your partner. The ongoing conversations, like I said, things are going to change over time. Your likes and dislikes are going to change. Your communication styles and your sex preferences, they're all going to change. Your frequency, your stress level because of work and kids and everything else is going to come into factor here. So this really needs to be an ongoing conversation for you. You might need to adapt to injuries or surgeries over the time, maybe some medical conditions. You just never know. And so these really need to be ongoing conversations for you. It's time for my favorite segment of the show, Between the Sheets Shenanigans. We've got some great stories for you, and as always, the details of the stories will be changed so that you cannot identify who the owner of the story is. It might be my story, might be my friends or family members, or even a patient's story, but you're not going to be able to tell. Please send in your stories as well so we can shake up the details and share your stories. Send them into podcastbetweenthesheets@gmail.com. Let's tell some stories. So the first thing for story time is dating and sex conversations. Can I just tell you that being on dating apps used to suck and you would get unsolicited pics? I have heard from women that we get more unsolicited dick pics than guys get unsolicited boob or vagina pictures. So I think that that is true, but guys can correct me, certainly, if I'm wrong. Get to know each other first. Don't be sending unsolicited pics. Don't talk about sex within the first 3 messages. I mean, come on. We're adults. We all want to have sex and we will get to that. But let's get to know each other a little bit first. Oh my gosh, I cannot tell you how many times when I was on the dating apps that I would get unsolicited pics or, hey, you're beautiful. How do you like to? Whatever. And when's the last time you had sex? And all these questions. And you're just like, we will get to that point someday if we're dating. But right now, no, thank you. Let's talk about what we do for a living and how many kids we have first. Other stories that I've come up with. Okay, so a friend of mine went to a bar to meet a gentleman that she was getting to know, and they both participate in the lifestyle. And so it was a contractual conversation that they had at an outdoor dock bar and sat there and talked about what was allowed and not allowed, what toys were allowed and not allowed, what names. This was going to be a dom-sub relationship. The man was going to be the dominant and the female was going to be the submissive, which is pretty typical, but there are plenty of dom-sub relationships that are opposite. And so they sat there in the middle of this bar talking about all of these sexual topics and yes and no, and I agree, I don't agree. And I just thought that was fantastic because it is such a great thing to do for anyone, but obviously for those type of relationships, definitely have to have the conversations and ongoing negotiations. But I think that that's just a great example of how these conversations can happen anywhere. And I always kind of like to play the people watching game and what are those people talking about and whatever. And this is one of the games that I played to see, do you think they're having a sex conversation over there? One of the other topics that I thought was fun, sort of in relationship to that, but was another friend of mine who was at a bar with a guy she was dating, and she would tell me that his favorite thing was when she had to go to the bathroom to take off her underwear and bring them back to him. So that was their little thing. They would go to the she would go to the bathroom while they were out having drinks at the bar and then come back and give him her panties in his hand, and he would tuck them in his shorts or jeans pocket for the night. I thought that was really cute and just kind of a fun way to bring a little sex appeal to your night and kind of get yourself prepared for after being out together. I had some patients who had not had sex in about 10 years. First, he had dealt with erectile dysfunction and, they were trying to work through that. The pills weren't great, but, they seemed to be giving him a headache. And then they started to get that figured out, but then she was dealing with dryness after menopause and the sex became painful. And it was just really decreasing their relationship and their intimate connection. It was really frustrating. And she had come to me and was seeing me for her vaginal issues, and we got her on some estrogen cream and we got her feeling better. And I said, send your husband to me. Come in together. Let's talk to him about his erection issues. Let's get you guys having sex again. And sure enough, they came in a few weeks later, and we were able to get him on a ED medication and figure out why he was getting the side effects previously. And so we were able to get him on a better dose. And they came back about 3 months later and told me that they are having so much fun and such a great relationship, and that being empty nesters is really great when you can have sex. So I absolutely love that story for my patients, and was wonderful. I have a couple who the man was dealing with prostate cancer, and so he has erectile issues after dealing with that. And he and his wife always come in together when he sees me for his treatments. And he would ask me, when is he going to be able to use those happy pills? And when are they going to work for him? Because he is ready to be happy. And he was referring to erection pills. And he was so ready to get an erection and have sex with his wife. He just absolutely adores his wife. And these people are just wonderful. Well, the pills weren't working. They just weren't doing what they needed to do for him. So I had them come in. And do a demonstration for penile injections, which can help with erectile dysfunction. And it was such a fun appointment with them, because they were both just giggling and laughing, and we talked through it and we got everything figured out and sent them home. And sure enough, the next time he came back in for a prostate cancer treatment, they gave me high fives and hugs, and they told me how fun it was and that they were so excited that they could have this connection again. So that is another really fun story, and just another way that shows that communicating and constantly having these conversations is really important between you and your partner in an ongoing way, because these things do change over time. One of my friends, when she was single, she likes to get away with things. That's kind of her thing. So when she dates somebody, she likes to tell them, I don't want to get caught having sex, right? But I kind of want to get away with something. And so her thing is dressing rooms. And so she loves telling guys she's dating that she wants to have sex in dressing rooms. And she's had sex in 3 different stores. And she absolutely loves this. She thinks it's funny to see how quiet you can be. Can you get away with it? What position can you be in to be able to get away with this? And just has so much fun with it. And the guys that have done this with her have had a great time. And I think that's really fun. So just some great examples of how you can communicate about sex, increase your sex life, and just have a really overall amazing connection with someone. And like I said earlier, if it's just not there and you like things that the other person doesn't, then that just means you guys aren't sexually compatible, and that's super okay. Or you can work through that and you can try doing things and talking through things that might work for both of you and get you more to a place where you can both be confident and comfortable in your sexual relationship. Thank you for listening and spending time with me today. You can catch new episodes of Between the Sheets every Wednesday, because what better way to add some spice to your life than to have a new podcast on Hump Day? We will continue to explore common, uncommon, and taboo topics related to sexual health and wellness. Please send any comments, questions, or stories to podcastbetweenthe.sheets@gmail.com. That's all one word, podcastbetweenthe.sheets@gmail.com. Have a great day. And remember how important it is to discuss these topics with your friends, your family, and of course your partners. In fact, you can follow, and share this podcast so they can see it too. See you next time for more sexual health topics Between the Sheets.